Welcome students, faculty, family, and friends. I'm Aviva, Dean for the Public Health and Professional Degree Programs. It gives me great pleasure to announce that the commencement of Tufts University School of Medicine's Public Health and Professional Degree Programs will now be in order. Warmest congratulations to our graduates and their families. Tufts is truly proud to launch you on your careers. Whether you're receiving a Master of Public Health, a Master of Science in Pain Research, Education and Policy, Biomedical Sciences, or Medical Science, and are our first graduates to earn a Master of Science in Health Informatics and Analytics, you are well prepared to improve the health of the populace. I have been delivering the commencement address to our new graduates every May for the last decade. That decade saw many momentous changes, including the rollout of the Affordable Care Act and its aftermath, a growing awareness of the health effects of climate change, and the opioid crisis, to name a few. My remarks have always emphasized the importance of the new graduates' careers. But this May, again and still connected by our screens, when I say it's an exceptional time to launch a career in health, it is no hyperbole. It's difficult to find words to characterize the unique backdrop for our commencement today. The last 15 months, we have grappled with all that the COVID-19 pandemic has brought. At the same time, and most acutely, is our collective and growing awareness that systemic racism and racial violence are indeed social determinants of health, and in too many cases, of life itself. Although some uncertainty persists about our ability to finally get the pandemic under control, we are increasingly optimistic that some semblance of normalcy will return to many aspects of our lives. What is certain is there will be lasting changes to public health. COVID-19 has focused attention on the government's role in public health preparedness, screening, testing, vaccine development, and healthcare delivery. Once again, and shamefully, the burden of health and economic consequences of the pandemic are borne disproportionately by those historically marginalized, people of color, and the poor. The rollout of the vaccine, again, has laid bare the profound chasm of unequal and inequitable opportunities for health. For many, the pandemic has been a much-needed civics lesson about the distinct roles and responsibility of state, federal, and local government. As students, you've had a front-row view. You've seen the power of big data to map and make sense of the epidemic surges. And you've seen how public health and healthcare systems, as currently organized, can or cannot be mobilized. As well-trained workers in health and activists, you should feel compelled to use your Tufts education, your new skills and insights directly to impact these formidable challenges. The current crisis may have temporarily diverted our attention from ongoing problems like healthcare access and cost, mental health, substance abuse disorder, environmental health threats, obesity, and chronic disease. But these remain. They and myriad other complex public health and healthcare challenges require transsectoral and multidisciplinary approaches. These will constitute your future work with the tools you have gained here at Tufts. We're confident that you will use these tools effectively and wisely. For those in our Master of Science in Biomedical Sciences program, many of whom will go on to medical school, you have proven your dedication to medicine. To our newly licensed graduates in the Physician Assistant program, your training and skills are urgently needed in all aspects of healthcare. You enter a profession undergoing massive change. We hope you will use your additional insights and knowledge you have gained at Tufts to think and act broadly about health. On behalf of the faculty, we are grateful that you have entrusted us with your education. It has been our privilege to guide your learning and to learn from you. The responsibility is now yours to keep up that education, to stay abreast of new information, and most importantly, to always ask questions and consider new perspectives. We have endeavored to equip you with concrete tools and critical thinking skills to put your ideas into action, to be change agents in your communities, however you define them. We are confident you will endeavor to make the world, or some part of it, a healthier and more just place. The need has never been greater. We, the faculty, have no doubt that you will bring credit to Tufts University School of Medicine and will make us proud. Please accept our heartfelt congratulations to you and your families for your accomplishments. It is my pleasure now to introduce Amanda Jung and Sahar Tirmiz, candidates for the Master of Public Health, Health Services Management and Policy concentration. They will now offer the class address for the Public Health and Professional Degree programs.
Thank you, Dean Must. We're honored to be here today as roommates, classmates, and friends. Normalcy. This is all we have talked about, thought about, and craved for the last year of our lives. We have commuted from our beds to our desks, been greeted by the notorious "your internet connection is unstable" Zoom notification, and marveled at our classmates' pets lurking in the background. Our graduating class is a witness to the most significant public health emergency of our lifetime. As we strive to return to normalcy, we must ask ourselves what we are working toward. What is normal? What should be normal? And what is our responsibility in the creation of a new normal?
The pandemic has revealed fault lines in our social structures, exacerbated housing and food insecurities, and caused a surge of anti-minority racism, all of which are public health challenges that have defined life for far too long. As these current issues have indelibly shifted our classroom learnings, our professors have guided us in viewing such events through a health equity lens. Our strained healthcare system has struggled to protect marginalized communities during this time, as seen by the disproportionate COVID-19 burden experienced by people of color. This has taught us that inequity is, in and of itself, a pre-existing condition. As a result, our class is uniquely positioned to shape a new normal in the health sciences field and beyond.
For everything this year has taken, though, it has also given. It has taught us to truly appreciate the resilience of our communities and our reliance on essential workers, from sanitation workers to teachers. For me, when I envision resilience, I think of my father, a Pakistani immigrant COVID-19 physician serving in Los Angeles, one of the hardest hit counties in the nation.
For me, I envision the resilience of the Asian American community in the face of a resurgence of violence caused by this pandemic. The collective experiences of the class of 2021 have united and shown us that now is the time, if there ever was, to care selflessly for one another.
In many ways, we have witnessed the best of our society through unprecedented voter turnout and countless Black Lives Matter marches. To a smaller degree, the class of 2021 has passed on knowledge and tools gained in our classrooms at the dinner table, ranging from addressing vaccine efficacy to implicit bias. In the pursuit of our degrees, we have pored over assignments, devoted our time and energy, and, for some, balanced a full-time job, all to further cultivate our passion for health. Now, as we prepare to graduate, we must consider, how will we apply what we have learned to this next chapter?
For PA and MBS graduates, as future providers, how can you embody cultural humility in the care that you provide? For health informatics and analytics graduates, how can you interpret health data to create equitable and efficient healthcare systems and processes? For prep graduates, how can you most efficiently manage pain for patients from different backgrounds? And for public health practitioners, how can we create proactive policies that equitably protect our communities? We aspire for a new normal, one that is intolerant of social and racial disparities, values equitable access to high quality and preventative health care, and is better equipped to support the most vulnerable.
As graduates of the physician assistant, biomedical sciences, health informatics and analytics, pain research, education and policy, and public health programs, we are a membership of colleagues who have power, in our knowledge, to advocate for a better future, one that we deserve and one that is within our reach. Memorialize the ways in which these times have revealed what truly matters: the resilience of our cities, the well-being of our loved ones, and the sacrifices made by those who give themselves to serving others. The moment before us is an invitation to use our education to heal afflictions and apply the best of what we have learned to our respective fields.
Do not let what is normal lend an excuse for complacency. Let us get to work so that decades from now, we can look around and say, we left things better than we found them. The class of 2021 will not be defined by what we lost, but rather how we respond.
Thank you.
Thank you, Amanda and Sahar. It is my distinct pleasure to introduce Reverend Emmanuel Daphnis. Manny Daphnis is pastor of the Restoration Community Church in Brockton, Massachusetts. As an alumnus of our MPH program in the year 2000, he has married his passion for public health and his strong religious faith throughout his career. He currently leads the Brockton Gun Violence Prevention and Community Coalition, an initiative funded by the Massachusetts Department of Public Health. Born to Haitian immigrants in Boston, Manny's passion is to empower others to achieve their potential despite what may have come about in their lives. Over the years, Manny has served in teaching, counseling, mentoring, research, and coaching settings with individuals of all ages. Additionally, Manny has served on a number of boards and currently is board chair of the Brockton Interfaith Community, serves on the board as vice president of the New Heights Charter School of Brockton, and also chairs the board of Operation Make a Difference, a parachurch youth ministry in Greater Boston. In addition to his master's degree in public health from Tufts, Manny completed his theological training at Gordon Conwell Theological Seminary, where he earned his master's in divinity. We are so pleased that Manny accepted our invitation to be our commencement speaker this year, and we look forward to his remarks.
This morning, it is with humble reverence that I stand before you. I do not take this invitation lightly, and I'm truly honored to have the opportunity to share with you for a few moments. Esteemed faculty, staff, administration, and everyone who helps to make Tufts the bastion of learning and stretching that it is. This morning, I salute and honor you for your tireless work of inspiring, challenging, preparing, and propelling the next set of dynamic thinkers, dreamers, innovators, and caregivers into the realm of service for which they were created. As a young man longing to discover where I fit in, Tufts gave me an opportunity to be exposed to some world changers, and for that, I am forever indebted. To the class of 2021, you made it. You endured biostats. You even endured epidemiology. You completed your applied learning experience in the midst of a pandemic. Today, we salute you and everyone in your camp that made today possible. As a matter of fact, this degree that you are about to receive isn't just your degree, it's theirs. Today wouldn't be possible if it were not for the sacrifices of your family, friends, colleagues, professors, and even some of the naysayers. And so today we salute the shoulders upon which you stand. For well over a year now, our world has been stopped in its tracks by the coronavirus. Nearly a year ago to the day, George Floyd was brutally murdered, sparking racial unrest throughout our nation, reverberating even beyond our borders. Mass shootings seem to be more common than they have ever been in our land, and the socioeconomic divide within our country continues to widen across the board. If you believe the answers lie in the hands of the politicians, whose chief job is to be a politician, you are gravely mistaken. There is a charge to the leaders and future leaders of this generation, a clarion call that screams from the mountaintops to the very space where you find yourself at this exact moment. You see, your time here at Tufts wasn't intended to simply add letters to the back of your name. Rather, your time here was so that you might understand with a bit more clarity who you are and how you can bring about change in the earth. As a society, we continue to see egregious trends in health disparities across racial and ethnic divides. Poverty, obesity rates, access to health care, particularly mental health services, access to positive youth programming and safe spaces are just a few examples of the ways in which your witness, your presence, your leadership is desperately needed in our world today. You were created for this exact moment. I am of the opinion that you were created on purpose with purpose. You ever wonder how you and the countless generations that preceded you on both sides of your family came together? And of the millions of sperm, the exact one with your name on it at the appointed time brought you about? There is a work to be done, and that work is to be done by you. Discovery of that work brings about a discovery of you. And in the same way The discovery of yourself is inextricably tied to the discovery of your work. There's work to be done. I was born just down the street here at Boston City Hospital to 2 immigrants from Haiti. Being the second of 4 children living in a pretty tough section of Mattapan, things were not always easy, particularly for those of Haitian descent at the time. In the early to mid 80s and even into the 90s as the AIDS epidemic ravaged our world, somehow Haitians all over the US, along with homosexuals, hemophiliacs, and IV drug users, were dubbed AIDS carriers. As a result of faulty, racially biased research conducted by our nation's finest epidemiologists and researchers, an entire people were subject to unfair treatment and scorn. Folks were fired from their jobs without warning, subject to discriminatory practices as it pertained to their housing. Moreover, as kids, if it was known that you were Haitian, there was an incessant derision that ensued. One of the common refrains that repeatedly went forth was HBO. Look at that HBO over there. HBO stood for Haitian body odor. Over time, science and research dispelled the myth, and in 1985, the CDC removed Haitians from this high-risk AIDS carrier categorization. Nevertheless, the ramifications ensued. The discrimination continued all over our country, which currently is home to over 1 million people of Haitian descent. People simply endured. And it really wasn't until the release of The Score by the Fugees and Wyclef Jean and Lauryn Hill in '95 that a broader societal acceptance came about. I want you to note the broad intersection of public health research and policy, discriminatory practices, politics, and even pop culture, yes, pop culture, upon the very livelihood of a people. It was right in the midst of that time that my journey of self-discovery meandered into a place of self-awareness of the plight of my people. In Haitian culture, like many from the African diaspora, there are 3 acceptable professions that you could pursue: lawyer, doctor, or engineer. High school came pretty easy to me, and because the expectation from my parents was I was supposed to do well, I did, even though they worked hard, long hours and some menial jobs. There would be consequences if we didn't do well. And so by the time I got to undergrad, with minimal effort, I got to go to a number of different schools. I had different opportunities. And I chose one that was right here in this local general area. I got to undergrad, I wasn't certain what I wanted to do. So I decided I was gonna go the pre-med route. And friends, I realized pretty quickly that that wasn't it for me. But what became loud and clear along the way was that I was created to be a change agent for those who have been socially marginalized as a result of systemic oppression and racism. To the vehement dismay of my parents, I majored in African and Afro-American studies and wanted to ultimately figure out how I could affect positive change for my people. And my journey then landed here at Tufts. As a part of the initial standalone public health class of 2000. And while along the journey, I wasn't totally clear about where I was going, how I would get there. But I knew that the work entrusted to me was bigger than me. Just as the work entrusted to you is bigger than you. I had to keep moving forward, just as you must keep moving forward. Then came, full circle, my applied learning experience. Even then, while I had been exposed to and even developed some of the necessary tools to walk into the journey before me, I still had to confront some of my own fears and biases. My ALE brought me to a small but significant nonprofit in Dorchester called the Center for Community Health Education and Research, C-SHARE. C-SHARE worked primarily with AIDS patients and their families as a resource and advocacy center. Many of these clients were of Haitian descent. I had the opportunity to see firsthand the resilience of a people, the unmovable, unwavering faith of my people, marginalized yet still fighting and standing. In the conducting of my key informant interviews, I recognized that some of the popular narrative promulgated by the aforementioned intersection of public health policy, discrimination, and pop culture, I subconsciously believed. And it wasn't until I could confront my own fears and biases that I could actually walk into the person that I was created to be. Adversity has this way of propelling you into destiny. It doesn't break you, friends. It makes you. And along the journey, I could see a little bit more clearly the charge that is upon me. While I may not know precisely the charge upon your life, the journey that is before you is not by chance or happenstance. There is a charge to the leaders and future leaders of this generation, a charge to the class of 2021, a clarion call that screams from the mountaintops to the very space where you find yourself at this exact moment. It screams for the voiceless and the marginalized. It cries for the disenchanted and the disenfranchised. Might someone care enough to see me? Might someone care enough to give their life so that subsequent generations might live? Will you answer the call and walk in your fullest self? Friends, this isn't about getting a good job. This is about creating the conditions that affect change at both a micro level and ultimately a macro level. This is about walking in your fullest self so that those who encounter you can see beyond their conditions, their oppression, their imprisonment. Family, critically assess what's before you. Compassionately listen. Boldly innovate. Lead. Be the jumbos that you are. Change the world, for your voice as a public health practitioner sits right at the intersection of change for all people. Thank you.
Thank you, Reverend Daphnis. We will now acknowledge the degree candidates of the School of Medicine's Public Health and Professional Degree programs. The candidates for the degree of Master of Science and Master of Public Health, whose names will soon be read, have been awarded this degree by the vote of the Board of Trustees in recognition of the successful completion of their studies and fulfillment of all requirements. Dr. John Castelot, Director of the Biomedical Sciences program, will share his congratulations with the Master of Biomedical Sciences students. Dean Janice Jilks, Assistant Dean for Student Services, will announce each candidate's name.
My name is John Castelot. I'm the Director of the Masters of Science in Biomedical Sciences program. I want to congratulate all of our MBS graduates today, and a double congrats to those of you who are completing one of our dual degree programs as MBS MPH or MBS MBA graduates. All of the faculty and staff here at Team MBS are so proud of you. You all have completed a rigorous academic journey under truly extraordinary circumstances. What started out as a typical school year in August of 2019 became a totally remote experience in the winter of 2020 as the COVID-19 pandemic hit. That turned what we think of as a very personal program into one that was completely remote, where you had little or no contact with your classmates, your family, or your friends. But you came through it. You came through it with patience, with flexibility, and with grace. And you did it because you had the resolve and the resilience to do it. Resilience is a trait that cannot be overestimated. Your resilience will take you far in life, whether it's your personal life or your careers. Whatever travails come your way, you know you have the resilience to overcome them. Now, Team MBS has one important request for you, all of you. As you devote your life to helping others, we hope you'll take the time to work with the poor and underserved, people without the privilege that you may have had. Think about the travails that they experience every day, even when there is no pandemic. Now, please know that Team MBS is always here for you. You'll always be a part of the Team MBS family. And speaking of family, please take a minute to thank your parents, your family, and your friends who have stood by you throughout your MBS experience here. And like family, we want you to be part of the boomerang generation. We want you to come back and see us often, whether it's for advice or to let us know how you're doing. Remember, we think the world of you guys. Best of luck to all of you.
Presenting the candidates for the Master of Science in Biomedical Science. Priscilla Abedu. Idir Abid. Marika Udell Bennett. Nejla Bernici Chalet. Jennifer Bolter. Jennifer Chen. Brianna Xavier de Oliveira. Lorraine D. Velez. Remy Lynn Monkey Dolan. Olivia Ann Etienne. Devin Michael Ivanovich. Emily Garcia. Stephen Gale. Danielle Beckel. Alexis Gabrielle Gonzalez. Iyo Guo. Pranjali Ichalkaranje. Jen Chi-Yoon Kim. Tae Yoon Kim. Maximilian Alex Kinney. Yu Min Evelyn Lee. Nicholas Austin Learhoff. Megan Jean Lee. Alexandra Murphy. Kayla Nicole Nodecker. Monica O'Brien. Nicole Sinclair Oglesby. Taylor Nicole Pearson. Jordan Puskas Sullivan. Teresa Rafferty Millett. Brianna Salmon, Delia Mariah Sosa, Cameron Spire, Sai Shreya Sunkara, Prutusha Tadapali, Nicole Tarichi, Tamila Tarivadieva, Jacelyn Tykatic, Richard Sung U Am, Eileen Vera, Alessandra Zaccardelli, presenting the candidates for the Master of Science in Biomedical Science and the Master of Public Health. Maura L. Redman, Bruna Voldman, Helen Zarawi, Peter Zazali,
Dear Health Informatics and Analytics graduates, congratulations. On behalf of our program director, Dr. Ramya Palachola, and myself, as well as all the faculty and staff here in the Department of Public Health and Community Medicine at Tufts, we offer our very best wishes for your future after you have been with us for quite some time as students in our program. Thank you for choosing us, and thank you for all the hard work that you have done. You were awesome students, and I'm pretty sure you will be as awesome in your career in health informatics and analytics moving forward. It's been great to have you, and I'm looking forward to hearing back from you after you have graduated. Thank you very much again, and congratulations.
presenting the candidates for the Master of Science in Health Informatics and Analytics. Mulham Al-Assad, Nicole Renee Allman, Irina Angel, Megan Elise Garcia, Kathleen Ann Gompertz, Shelby McQuestion, Abigail Riley Mechanic, Shravidya Harya Yasami, Angela Mercedes Riley, Jennifer Leigh Torch.
I'm Dr. Libby Bradshaw, Academic Director of the Pain Research Education and Policy Program. And I have great pleasure and delight in congratulating our graduates of the Pain Research Education and Policy Program for their Masters of Science. You came here with great heart and spirit and a determination to understand the complexities of pain. And you have done so over a course of 1 to 5 years. You have studied this great public health problem and have understood how to really change things around it, both at the biological, medical, the psychological, social, political, and spiritual dimensions of pain. And you are determined to make a difference in this world. We congratulate you for your accomplishments in the program and know that you have really individuated and really taken the understanding of pain to ways that you're going to apply it moving forward to make the suffering less, to understand how to meet the needs better of our communities and our society and individuals living with pain. Congratulations. Thank you for all your spirit and heart.
Presenting the candidates for the Master of Science in Pain Research, Education, and Policy. Shirley Moore Caniff. Ingu Steve Jang.
Hello, my name is Beth Bouillet. I am the Program Director for the Tufts University School of Medicine Physician Assistant Program. Today, we have 2 groups of graduates. Of the 50 students in the class of 2021, 8 have completed a dual degree and will be awarded both their master's degree in public health as well as their master's degree in medical science. The remaining 42 will be awarded their master's in medical science. I am so proud of the 50 PA students in the class of 2021. You have all shown flexibility and resilience during a time that none of us could have predicted when you started this program back in January 2019. In the face of a novel virus that we were discovering new information on almost daily, each of you made a decision to continue to learn and grow while caring for patients and families impacted by the COVID-19 pandemic. You were right alongside the frontline workers each day on your clinical rotations. You became essential members of the hospital and clinical teams. Our students completed the program back in January, so I know many have started their PA careers or will be in the upcoming weeks. I just wanted to say one last time, congratulations on all that you have accomplished, and thank you for the work you are about to engage in for your future patients and our healthcare system. Stay in touch.
Presenting the candidates for the Master of Science in Medical Science, Physician Assistant Program. Brian Chia. Madeline Camp. Danielle Rasmus. John Cameron Felix Swinton. Presenting the candidates for the Master of Science in Medical Science, Physician Assistant Program, and the Master of Public Health. Catherine Blake Anderson. Michael Robert Gladhill. Ellie Marie Glasgow. Jillian Keating. Claire Stauffer. Aja Zimmerman.
Greetings all. I'm Tony Schloff, Director of the Public Health Program. It's now my great honor to congratulate the candidates for Masters of Public Health as we bestow that degree on them. After a year or more of hard work in a difficult time, you are now prepared to take the tools you have learned here to work to address some of the great problems facing our nation and our world. I hope and I trust as you take jobs, whether it's in the public health infrastructure or as a combined degree graduate, you take your public health perspective to another discipline, that you remember the upstream causes and significant inequities that drive many of the public health problems of our time. That even as you work on a day-to-day basis on specific tasks, you also keep in mind our shared responsibility in this profession to make the world a better place by addressing those inequities and those upstream causes. We know you have the tools, we know you have the courage and the conviction to do these things. So we look forward very much as the years go on to hearing about you, as well as hearing directly from you to let us know how you're doing. You're always a member of the Tufts family, and we're glad to have you join our profession. All the best.
Presenting the candidates for the Master of Public Health. Miriam Abdul Rahman. Hanuja Gunesh. Tori Danielle Martel. Brenna Miller. David Augustus Pryor. Chloe Alexandra Wilson Schwartz. Elisa Gay Anneser. Ashley Denise Benitez. Nicole Casarino. Chloe Chung. Sarah Couture. Sarah Elizabeth Galinko. Bo Liu. Megan Martell. Yaritza Peña. T. Ray. Emily Reisberg. Ian Richards Roy. Casey Ann Saburin. Isha Tunasia. Dominic Voller. Palin Wang. Melissa Wu. Holly Yu. Guangxi Zhang. Alicia Cardarelli. Lauren Creedon. Krutarth Dave, Sarah Hart, Eliza Devon Hilfer, Rachel Jackson, Amanda Jung, Sora Kim, Meredith Jean Lawler, Deborah Lee, Keely Menezes, Allison L. Moki, Ria Mohan Numbiar, Jeffrey Dean Oaks, Avina Patel, Sahar Tirmiz, Meva Vayar, Ian Cornelis Ware, Casey Burke, Dorcas Mabiala, presenting the candidates for the dual JD and Master of Public Health: Emily Broadkin, Joanne Hyun, presenting the candidates for the DMD and Master of Public Health: Omar Harmouche, presenting the candidates for the Master of Public Health and Master of Science from Friedman School of Nutrition Science and Policy: Gabrielle Casuto, Grace Flaherty, Rugo Lee, Ian Gregory Moore, Lauren Page Penkert, Ariella Sella, Samantha Tweedy, Sarah Ann White. We would like to honor all of our degree candidates and our award recipients who were unable to participate in our ceremony today. Congratulations on this wonderful achievement.
It's now my pleasure to introduce the faculty slideshow. Congratulations to all the graduates. I'd also like to extend my appreciation to all the staff and faculty for their commitment to the virtual ceremony today. This now concludes Tufts University School of Medicine's Public Health and Professional Degree Program's commencement. Thank you.